You ready? So this morning we're going to talk about, this is your primary and your secondary tubing. We're going to teach you how to prime it and set it up so that whenever the person needs any kind of fluids or an antibiotic, it'll be set up, and we're going to teach you the right way to do that. So what we're going to start out with is you got your primary tubing right here. And if you'll notice, it's got your drops per mLs on there. And this is 20 drops per ml. And this is your primary tubing. And this tubing actually goes with our Alaris pump. So depending on where you're working, what kind of pumps, they'll have the tubing that goes with it. Then you'll also have tubing that you have to count the drops per minute. Make sure it's dropping, and it's fed in by gravity, and it's not connected to a pump. On this one, this is called your secondary. Also, it's got the drops per minute on there. We've got a 50 ml bag of normal saline. And then we've got, this is a 250 bag. So we're going to use this as the bigger one. It's going to be our primary infusion right there. And then, of course, we've got the labels. So you put, the patient's name. You're identifying your medication and making sure it's labeled and going to the right place and everything. So I'll show you how to fill that out. So the first thing I'm going to do is hand hygiene. Whenever you do checkoffs, it's not going to be a formal checkoff, but we are going to go, pump by pump, making sure that you understand how to do it and you're able to do it. So we want to see you perform your hand hygiene, know your ABCDEs. You would take that order, you identify your patient, name, date of birth, ask them about allergies, okay? So the first thing I'm going to do, we're going to take our primary tubing, and it's perforated on the side, normally. Here we go. So one of the things I want you to learn, when you take this tubing out, get into the habit of the first thing that you do is you take this roller clamp and you close it, okay? Because once you get this all connected, the fluid will start going into the tubing, and then it's going to drain all over the floor if you don't do that. All right? We can take off this blue right here. And like I said, this tubing's for this Alaris pump. Y'all are going to get to practice this. Kind of straighten it out. And this is your drip chamber. It's flexible. This right here has a cap on it. It has to remain sterile at all times, and I'm going to show you how to access your normal saline with that. We're going to take our large bag of normal saline. It has a tear right here. You just pull it down the side. Whenever you've got your bags, you want to look for clarity. Make sure that it's not expired. So these bags are expired, but when you're actually working in a nursing home or a hospital, they won't be. If it is, you need to get another bag. And looking for clarity, making sure that we've checked this against our MAR, that we've got the right kind of fluids in the bag. Because you got normal saline, you got dextrose, you've got half normal saline, all that. So this one's sodium chloride, 0.9%, so that's what we're looking for. So what we're going to do, and it has a little loop here, we're going to go ahead and hang this up. This port right here, whenever, like in pharmacy, if they're making your medication bags, they'll take a needle with the medication in there, and they'll access this, and the medication will go in here and create that. This one right here, you'll pop that off. I'll show you right now. All right, so I'm taking the cap off. I'm making sure that I do not contaminate the cap, okay? You'll pop this blue part off. You don't want to touch the end of it, but you want to access it in one quick movement. Get it all the way up in there. Make sure that it gets in there, okay? And then you squeeze the drip chamber. You want to fill it up a little bit, about halfway. You want to be able to see the drops actually going into the chamber so that you know that the medication's infusing. Okay? Remember, we closed our clamp so we're not pouring out all over the floor. So we'll take our clamp, and then we take the end of the line, and it has a cap on the end of it. And we're going to open up the clamp. You see how the fluid's running through? So we're going to watch it all the way down. And so this is priming our line. And you stop when it gets to the end. All right, if you have a lot of bubbles, which I don't see any right here. Here's a couple. You can kind of see them. That's not going to hurt your patient. If you just want to get them out, you can kind of do that, and it makes the bubbles go up. Same thing with the tubing. See, there's some bubbles in there. See how they rise up and kind of get rid of them. They kind of dissipate. So we're just checking our line, making sure that it's primed correctly. We don't want to give them an air bolus that can really harm them, where it's like half your line all air. We don't want to do all that. So those little bubbles are just fine. And we're all the way down to the end. And we've got our cap on. We remain sterile. We're good to go. So there's our primary line. Whenever you've got just regular fluids infusing into your patient, say they've got a medication due at 9 o'clock. So this would come down, say, from the pharmacy, and it's already got medication instilled into this bag. So I'm going to go ahead and open it. Remember, I'm looking for clarity, making sure it's not expired, and making sure it's the right medication. So you're doing your rights to medication administration. Here's our secondary tubing. Open it up, got the perforation up there. Remember, the first thing that we're going to do is we're going to close that clamp. This right here is your little extension. I'll show you what to do with that. So it's just a shorter tubing. This is your secondary tubing. So you can either hold it, pop that blue cap off and insert it, or you can hang it up. It's whatever you're comfortable with. So I'm going to pop that off. Make sure I don't touch the end. Same thing with the spike right here. Squeeze it down on there. Got my clamp closed. I'm going to hang it up. We screws our drip chamber. Now we need to prime the line. We're going to open that up. You can watch it, see how it comes down. And we don't want to waste any of the medication, so you want to be careful, go slow, maintain control. Boom. All right. So there's our secondary. This right here, you got to remember, so this is our primary bag. Right now, we're wanting to infuse our medication in our secondary bag. For this to take place, this bag has to be lower than this bag because gravity is going to pull from this. Once this runs out, it's going to automatically switch over to this bag and continue infusing. So you take your little clip here. You can hang it like this. Some people even double it up. You got to watch the drips, make sure it's infusing like it should. Sometimes it's not low enough, okay? Alcohol pen. And push pause.